The World Health Organization (WHO) has confirmed that Africa will receive 20 million doses of the COVID-19 vaccine this month as part of the 90 million doses committed. The AU member states are prioritizing sections of populations through the rollout of individual plans. Disparities in population sizes, however, is a concern for countries such as Namibia, as this could influence the distribution of the COVID-19 vaccine among the AU states.
The vaccines, once available, they should be available to all countries, and that everybody should have access to it. And those people who are in our country, it should not be the big country getting more, the smaller country getting less, or the smaller country get everything. We have a small population. If we can vaccinate all our people, then people who have 60 million, Nigeria has more than 100 million, Egypt has something, Ethiopia has many people. So we want to work together as a continent.
About 60% of African citizens would have to be immunized to achieve the continental herd immunity as cases continue to surge. By Sunday, Africa's confirmed cases stood at more than 3.6 million and over 80,000 deaths, according to WHO's regional office.
We should provide the necessary resources, either to purchase or to produce or to transport or to distribute these vaccines so that our people can get healthy. Once we are healthy, we don't expect, wherever you go, you expect, will I get sick, will I not get sick? Will my child go to school, my grandchild go to school, and so on. Once we have the necessary vaccines and we can know that the infection rate is going down, economy will come up and that money will be recovered. But once we think we can save the money while people are getting sick, that's not a winning formula at all.
The African Vaccine Acquisition Task Team is leading the continent's efforts to secure enough doses for the people. The team has secured 670 million vaccine doses to be distributed between 2021 and 2022, a process that is heavily dependent on countries securing adequate financing.
The African Union has made a call for developing countries to be assisted in their efforts to combat the pandemic and to rebuild their economies.
Namibia also wants increased training for Africa's scientists and other medical specialists. This, it argues, will help prevent the continent from being just a spectator from sidelines when wealthier nations are producing medicine to save their citizens and prepare for eventualities.
We should have the capacity, at least the capacity, to produce those vaccines ourselves. And because once we produce it here, transportation becomes easy. But as long as we have to go and buy for them, transport them, bring them here, distribute them country to country, and then once you have them in your country, then from region to region and town to town. It will take time. And in the meantime, people are getting infected and get sick.
Some AU member countries are still battling with accurate provision of COVID-19 information due to skewed data collection methods. This is coupled with reluctance in mass and compulsory testings being prioritized, among other factors. Blanche Kore says NBC News, State House.